The fluorescent lights of St. Catherine's pediatric ICU hummed their eternal dirge as Dr. Sarah Chen reviewed the charts one more time, hoping the numbers would somehow tell a different story. They didn't. Baby Emma Rodriguez, just 7 months old, was in heart failure. Born with a rare congenital defect, she'd already survived 2 surgeries, but her tiny body was giving up. The transplant list was long, and time was running out. Emma's parents, Miguel and Rosa, had been living at the hospital for 3 weeks. Rosa hadn't left her daughter's side except to shower. The grief had carved hollows beneath her eyes, and she moved through the ward like a ghost, barely speaking. That's when Kaiser arrived. Kaiser was a 3-year-old German shepherd who'd washed out of police K9 training, not because he lacked intelligence or ability, but because he was too gentle. Where other dogs learned to bite and hold, Kaiser learned to lean in and comfort. His handler, Officer James Morrison, had adopted him and enrolled him in a therapy dog program at St. Catherine's. "Mrs. Rodriguez," James said quietly, Kaiser sitting perfectly at his side, "this is Kaiser. He visits children here. Would you mind if he spent some time with Emma?" Rosa looked up with hollow eyes. "She's unconscious. She won't even know he's there." "Maybe not," James said gently, "but you will, and sometimes that matters too." Rosa nodded, too exhausted to argue. What happened next would perplex doctors and become the subject of medical journal speculation for years to come. Kaiser approached Emma's incubator with unusual purpose. James had never seen him move quite like this, decisive, almost urgent. The dog sat beside the tiny plastic bubble that contained the dying infant, and then he did something he'd never done before. He began to hum. Not a whine, not a whimper, a low, resonant hum that seemed to vibrate through the floor. "That's unusual," Dr. Chen said, watching from the doorway. Kaiser kept humming, his eyes never leaving Emma's face. Then he placed his paw against the incubator's side, directly level with Emma's chest. An hour passed, then 2. Kaiser didn't move. His hum continued, steady as a heartbeat, which is precisely what Rosa noticed first. "Her monitor," she whispered. "Look at her monitor." Emma's heart rate, which had been erratic and weak for days, had synchronized with Kaiser's humming. The chaotic spikes had smoothed into a steady rhythm. "That's coincidence," Dr. Chen said, but she was already moving closer, checking connections, recalibrating equipment. It wasn't coincidence. Over the next 72 hours, Kaiser barely left Emma's side. James brought him home only for necessary breaks, but the dog would whine at the door until they returned. The nursing staff made special accommodations, setting up a bed for James in Emma's room. Hospital protocol had never bent quite like this before, but no one could deny what they were witnessing. Emma's vitals continued to stabilize. Her oxygen levels improved. The medications that had barely been keeping her alive suddenly seemed to be working. Dr. Chen consulted with colleagues across the country, but no one could explain it. "Animals can sense things we can't," one specialist suggested. "Maybe the dog is reducing her stress hormones, even unconsciously." "She's 7 months old and barely conscious," Dr. Chen countered. "What stress hormones?" But the data didn't lie. Emma was getting better. On the 5th day, something even more remarkable happened. Kaiser, who had been maintaining his vigil with the dedication of a palace guard, suddenly stood up. He walked to Rosa, placed his head in her lap and looked directly into her eyes. Then he returned to Emma's incubator and barked, just once, sharp and clear. Emma's eyes opened. They'd been closed for almost 2 weeks, but now they were open, wide and bright, tracking movement around the room. She turned her head, weak but purposeful, toward the sound of Kaiser's breathing. Rosa started sobbing. Miguel grabbed the nurse call button. Dr. Chen came running. Over the next 3 weeks, Emma's recovery accelerated beyond any medical prediction. The heart that had been failing began to strengthen. The medications started working with unprecedented effectiveness. By week 6, she was breathing on her own. By week 8, she was off the critical list. The cardiac specialist who'd given Emma a 5% chance of survival stood in her room, shaking his head. "I've been doing this for 30 years, he said. "I've never seen anything like it." Kaiser continued his visits throughout Emma's recovery, but something had shifted. His work, whatever mysterious work it had been, seemed complete. He returned to his regular therapy dog duties, comforting other children, but never again with that same urgent purpose. Emma Rodriguez was discharged 4 months after Kaiser first sat beside her incubator. Her parents brought her back for regular checkups, and each time they'd stop by to see Kaiser. Emma's face would light up, and she'd reach for him with grasping baby hands. Kaiser would sit perfectly still, letting her tiny fingers tangle in his fur, his tail wagging slowly. Dr. Chen wrote up the case, carefully documenting everything while acknowledging what couldn't be explained. The paper was peer-reviewed and published, spawning debates in medical and veterinary journals. Some suggested quantum entanglement between mammalian nervous systems. Others proposed unexplored frequencies in canine vocalizations that could influence human cellular repair. The theories multiplied, but the truth remained elusive. James Morrison, who'd witnessed it all firsthand, had a simpler explanation. Kaiser knew that baby needed him, he said. However he knew, whatever he did, it came from that knowing. Some things don't need scientific papers. Some things just are. On Emma's first birthday, the Rodriguez family threw a party at their home. They invited the hospital staff, Dr. Chen, and of course, James and Kaiser. Emma, now a chubby, healthy toddler with a mischievous smile, spent most of the party pressed against Kaiser's side. She'd take a few wobbling steps, then return to him, patting his head with the casual ownership of someone who knew, even if she couldn't remember, that this dog had saved her life. Kaiser, for his part, seemed content. He'd done what he came to do, this dog who was too gentle for police work but perfect for miracles. As the sun set and the party wound down, Rosa approached James with tears in her eyes. "How do you thank someone for giving you back your child?" she asked. James looked at Kaiser, who was patiently enduring Emma's attempt to use his ear as a teething toy. "You already did," he said. "You let him do what he was born to do. That's all any of us can ask for." Emma Rodriguez is now 5 years old. Her heart is strong. She's in kindergarten, learning to read and insisting on a pet dog of her own, a German Shepherd naturally. The doctors call her their miracle patient. The nurses call her their favorite success story. Rosa and Miguel call her their daughter who was dying until a gentle, failed police dog decided otherwise. And Kaiser still makes his rounds at St. Catherine's pediatric ICU, bringing comfort to children and parents alike. He's older now, graying around the muzzle, taking the stairs a little slower. But every once in a while, James notices him pause outside a particular room, tilt his head as if listening to something no one else can hear, and then move forward with that same old purpose. Maybe there are frequencies we can't measure, connections we can't quantify, and miracles that happen in the space between heartbeats, dog and human, beating as one. Or maybe Kaiser just knew what so many of us forget, that sometimes, all a dying heart needs is someone to sit beside it and refuse to let it give up.